Curious about what skills you could learn on a leadership placement for healthcare students? I'm Emma, a student dietitian on placement at the West Yorkshire Allied Health Professionals faculty, and I'll tell you about what skills you can expect to learn on your student leadership placement. Each healthcare course will have a slightly different set of skills that students need to evidence whilst on placement, and they all call them slightly different things like skills, proficiencies, or capabilities. Regardless of which healthcare course you're completing, there's a lot of overlap between these essential skills. All healthcare professionals need to have skills like communication, teamwork, time management, and many more which can be applied to any role that they plan to work in future. Firstly, communication skills. Whilst on the leadership placement, you can expect to develop your communication skills both with other healthcare professionals and other students or learners, but you're less likely to be speaking directly to patients. You'll develop many different communication styles by generating videos, writing articles or guidance documents, and presenting the work that you've done. Presenting or public speaking is a communication skill that many students are fearful of, but during this placement you'll get many opportunities to practice this. You'll need to be able to communicate well regardless of which roles you go into in future. And once you've mastered presenting your work to other professionals, speaking one-to-one with a patient will feel much easier. Teamwork and collaboration skills are quite easy to evidence on a leadership placement because you're always working with different people. Try to be aware of your own strengths and weaknesses. Co-production of your project means making the most out of other people's knowledge and experience and how they can help fill the gaps in your knowledge. Some elements of your project might feel out of scope of your placement. Being able to identify those and delegate or ask for support from other people is an important part of teamwork. Working together with other people is likely to come up in any workplace as it allows teams to be more productive by making the most of everyone's strengths, experiences, and perspectives. In healthcare, each professional has a unique role and we need to work together to provide a high-quality service. During a placement like this, you can master your organisation and time management skills, as there's often an element of planning your own time and meeting deadlines. I'll tell you more about how you can do this in our video on how to get ready for and make the most out of a leadership placement. Organisation and time management is important for all of the pillars of practice. In a clinical role, you're likely to have your own caseload or ward to oversee, and knowing how to organise your time to support them is key. In a research project, it's important to plan all the steps you will take to get from start to finish. And if you go on to education, you'll be responsible for planning student timetables. Students often worry about demonstrating their evidence-based practice or clinical reasoning during a non-clinical placement. But remember, during projects, presentations, and written documents, you'll be researching your topic and justifying your decisions with evidence. Remember, your professional process can be helpful to guide you through this. Once you return to university, having this prior knowledge can aid your assignments as you may be more confident in knowing where to look for information, justifying your decisions based on evidence, and writing or presenting your work. Whether you then go on to a clinical or non-clinical role, the expectations are the same, making decisions based on reliable evidence. You'll gain a greater awareness of leadership and strategy by being exposed to people in senior roles and conversations they have to develop their services. You'll see how real data impacts decisions, such as statistics related to health inequalities or diversity in the workplace. Leading on a project gives you a chance to apply those key leadership skills. Once you graduate and have your professional registration, you'll be expected to lead in several areas of your work, such as patient care and your own scope of practice. Having evidence of these skills from your placement helps set you apart from others in interviews. Being able to talk about how you led on a project during your placement and the impact that it had is a great thing to talk about. You're likely to be using education and training skills within your leadership placement, as many of the projects you can work on include an element of educating through presentations, videos, or webinars. In a clinical setting, most healthcare professionals are giving advice to patients. so you're educating them by sharing your knowledge. Once qualified, you have a duty to support future students. Learning how to support others early on in your career can be very beneficial. You're likely to improve your digital skills during this placement. Your confidence in using software like PowerPoint, Teams, and Adobe will grow, and you may be exposed to new systems you've not heard of before, like Beyond, which I used to create this video. I really enjoyed the creativity involved in a project like this. As technology has evolved, healthcare staff have needed to build their digital skills. In clinical settings, most patients' notes are on an online system. In the NHS, there are lots of different systems that are used, and throughout your career you're likely to be exposed to many different new digital software or systems. Being able to adapt to new digital systems, including knowing how you learn best, is important. And finally, self-development skills. Being able to acknowledge and work on your own personal knowledge, skills and behaviours is key. Being reflective when meeting with your supervisor by considering things that went well, opportunities for development, and points for action can be useful to help identify your areas for improvement and actions to take. Having independent study time provides an opportunity to build on these. As you're likely to have more self-directed and autonomous working, this is the perfect opportunity to identify your barriers to self-motivation and productivity and work to overcome these. CPD, or continuing professional development and reflection, are important parts of all healthcare professionals' careers, as they will be part of your HCPC or NMC standards. We hope you found this video about skills you can learn on leadership placements for healthcare students helpful. As a student dietitian, I really enjoyed my leadership placement and hope you do too. For more information on student leadership placements, including what they involve and how to prepare for or make the most out of your leadership placement, check out the other videos in this series.